I work in a maternity ward, and so my daily routine is interacting with mothers and their families. These are pregnant mothers who come to deliver at our facilities. So generally I deal with direct patient care, that is assessment of these mothers, where you do the assessment and you find if the mother is, the labor process has begun, and from there you're able to continue with the assessment, check on the mother in terms of all the vital signs, that is the blood pressure. You look at the gestation period. Is the mother ready for delivery?
I'm entitled to work in an health center where you report, it will depend with the duty rota. If you are working on night shift or on day duty, if you are reporting on day duty, you have to report between 7 and 7:30 a.m. and then you leave at 5:30 a.m. 5:30 p.m. And if you are working on night shift, you have to leave the facility at 4:30 p.m. and you leave in the morning at 7:30, between 7:30 and 8:30, and between 7:30 and 8 a.m.
We have so many obstetric emergencies that come along with deliveries, and we are well equipped to handle some of them. Some which we cannot be able to handle at our point of care, we are able to do a referral. And for us to do a referral, we need an ambulance. And in such an occasion, then I am able to accompany the patient to the point of referral.
We want to change our working schedules to have only 2 shifts in a day. So you have to report, if you are reporting on night duty, you have to report at 4:30 p.m. so that you give time for the day staffs. They give you the report so that at least by 5 p.m. they will have left the facility due to curfew. So you report at 4:30 p.m. and you leave in the morning between 7:30 a.m. or 8 a.m.
I would say it's challenging. Challenging because one, we were not prepared. I would say we were not prepared for the pandemic. By prepared, I mean in terms of training and in terms of availing the PPEs to the healthcare providers and even in the community.
Sometimes if you have a patient, maybe a delivery, you have to complete your report, you have to hand over. So you end up leaving the facility at around 9 a.m. So it is really tiresome because those are continuous over 16 working hours. So if you are very busy, you can imagine working for 16 hours without any break. And when you report at 4:30, you are the person who is providing for yourself meals. There is no even milk for you to prepare tea. There is no sugar. It is up to you. So you can imagine reporting at 4:30 with no supper until the next day in the morning.
I like my work as a nurse, but sometimes I'm faced with fears because at the moment every patient or every client who is coming for my service is a suspect. And for me again to get to work, I have to maybe get into a public means. So again, I expose myself, I get to work, I meet more clients, I meet more patients who are still suspects. So for me it is challenging, but we are trying to cope up. Before, we could get to work and it was business as usual. There is no one who is putting on a mask. Sanitizing wasn't as like we are doing of late, social distancing. So before it was getting to work you could just get to work and start working. At the moment you have to be careful. Who are you even speaking to?
The schedules have changed. Even working without all the proper equipment, it makes you more tired. It makes you more exhausted. It makes you even feel that maybe there is something you are missing.
Our working shifts have changed. If you're reporting on night duty, you get to work at 4:30 p.m. As compared previously, we used to get to work at 6 p.m. So at the moment if I'm going on night duty, I will go and release my colleagues at 4:30 because of the curfew. So I have to get a bit earlier. And my colleagues will come at around 8 a.m. So you see, if you're reporting on night duty, you tend to work longer hours as compared to what we used to have before.
Working with no PPEs. There is no PPE. We are told by the minister that do not attend to any patient without a PPE. But you fail to wonder, there are not enough PPEs. What will I do to the patient, or the patient who comes to the facility? When I go and watch that mother at the gate, because maybe they don't want the gate man to open, they don't want the security officers to open, the receptionist will not receive that patient. Are you going to watch your own Kenyan brother, your own Kenyan sister deliver at the hospital gate because you don't have the PPE? So we end up risking.
Could be the lack of PPEs. Those are the personal protective equipment. At the moment, we have the surgical masks. In my case, I've not seen an N95 mask at my place of work. So for us, we are putting on the surgical masks.
They are giving us only one mask. How can you put on a mask for 16 hours? Only one mask. You have 2 or 3 more deliveries to conduct. Are you going to throw it away?
If I have a case that fits the case definition of a patient with COVID-19, I don't have the right PPEs to handle that patient. The surgical mask is just a normal mask with a filter. So it filters the bacteria and the viruses to a certain degree. Now the N95 is a better mask because now, like, the surgical mask will protect you against viruses and bacteria maybe to around 90%. But if you have the N95, that is the mask with a filter at the front, the protection rate is higher to 100%. So it's like you're assured, if this patient has COVID-19, I won't get it. But if I'm putting on a surgical mask, I'm not assured. Yeah, in the course of my life, I've had to make a difficult choice. Generally, even doing nursing as a course is a difficult choice because for me, I qualified to go to the university, but of course I didn't come from a well-up background. My parents could not afford to take me maybe to do medicine, so that's why I found myself in nursing.
There were 2 lives that were lost. They were lost because maybe I offered to give my 100 shillings for them to go and buy medicine late at night to save his life, but they both of them lost life. I still feel that death is still tied around my neck. If I never gave out my money, the father would just have lost the son, but not the father. So it is one of the cases that I would not want to remember. Another time I had to leave my daughter in the hospital to be taken care of by my colleagues because I have to go to work. There's shortage of staff. So I was forced to go back to work so that I cover, because the other staff, there was no one else who was to release her, and she could not work for 24 hours. So there are so many instances where nurses have been raped at night, in working facilities. Myself have been assaulted by a relative whose child was treated by a clinic officer during the day. And the mother did not buy medicine, so the baby went and died late at night. And the next day they wanted the prescription. When they were given, I could not give the prescription because I'm not a clinician who had seen the patient. But we ended up as, I got the red because I'm the one who was met in the facility. The community was very aggressive and they were shouting. And they said that the baby had been killed by the staff because we did not give medicine. And you cannot give what you don't have.
As a healthcare provider, there are difficult decisions that we have had to make on behalf of our clients, some of which can be argued otherwise. Because let me give an example where you know that the client has a right to some information to remain as private. But you know, keeping that information as private is going to cause much more damage to this client and maybe to the family. So sometimes you're caught in between. For example, let's say about HIV status of a lady. And now the disclosure bit to the husband. I have witnessed quite a number of outstanding experiences from my colleagues, and the most touching of these are when a woman comes to deliver and this woman has nothing totally, maybe for the baby. In terms of the woman doesn't have clothes for this child. She has no food, and even she has no fare to go back home. So for us, like in my current station, not one, not twice, quite a number of times, us as the nurses, we have been able to buy clothes for some of the women, even give them fare to go back home. Some of them, we have even bought them food. And sometimes it's not just because duty calls. It's just because we have the heart to do what we need to do for Wanjiku.
It's becoming even emotional. When you are going to work, you know you are going to work, and at the end of the day you may come back with coronavirus. For me, I've stopped watching TV. I don't want to be tortured more because that nurse, maybe some of them even are from better countries who are well equipped, and us who don't have the equipment, we end up even having more emotions. That at the end of the day, even the other day I took on my father, I told him I've gone, but I don't know what can happen to me. I'm working, because they keep calling, you keep telling them that anything can happen anytime. So we are prepared, but we are not prepared for the best, but we can be victims.
For me, my number one fear is I'm at work and I don't know whom I'm serving. I don't know if the client I'm serving is a contact to a COVID-19 case or is even sick. So for me, when I watch those videos and when I come back to work, I am scared. The reason I'm scared, I don't have the adequate PPEs. The second reason I could be scared is because I will go back to my family. Once that shift is over, I am going back home. And note carefully, I will use a public transport means back to my home. I will get home, I will find my children, and I will stay with them. If I'm on off duty, I will be going nowhere. So I will stay with with my children. So yes, the videos are scaring, and even where we work currently, we are scared. We are scared even to think of attending to a patient who could be a contact to a case of COVID-19.
Even we've seen nurses who have died. Literally, they have died in the course of duty. They just collapse because sometimes they have no time even to go for medical checkup. So they are living with the illnesses, and I've witnessed so many of them. And the government doesn't care. They don't even provide enough care for our staff. For me, like I felt that I will go and infect my kids and to take them to my parents and advise them and give them information that I don't want to infect them. They were not willing to leave me because they feel that it's like neglecting me. But you see, you have to make a sacrifice. Even the other people that you are living with, when you are going even in the public transport, you feel that you may have the carrier of this infection and you go and infect innocent people. So we are carrying guilt all around.
We heard the president talking about a welfare package for the healthcare workers, but we've not. That has not come out clearly, so we really don't know if there is an insurance. So for us, at the moment, if I would get sick, I would still use my NHIF. That is the only insurance cover that I have with the government.
The nurses from the clinic officer and our family from Garage Center. There was also, and today there was a case of an health worker who was reported to be living in a river and works in Nairobi County. That is also a health worker. There are so many health workers who are experiencing even the stigma because one, they have already been put into quarantine. The families doesn't know their outcome. So it is there.
We've seen health workers who turned positive. Even in the private hospitals, we know there are nurses who have contracted the illness. At the Kenyatta National Hospital, there was a child who died in the ward and later was confirmed to have the COVID-19. Those nurses, those healthcare providers had to be put on quarantine. So we cannot dismiss. It is true that healthcare workers have contracted the COVID-19 in the line of duty.